And recording has now started. So by way of introduction, Purified Systems is the health protection system member benefit provider for RVIC, for the Canadian Camping and RV Council, for the Recreational Vehicle Dealers Association, and for the North American Fleet Administrators Association. Our focus over the last 7 years has been keeping the environments in which we live, work, and travel healthy and safe places to be. So this presentation, which will probably take about 15 or 20 minutes, and then we'll get into Q&A, will give you some insight into the 6 best practices that our customers have deployed for opening safely for the 2021 season. Let's first talk, however, a little bit about why do we refer to a health protection system? Well, we have been monitoring 4 key health threats since we founded the company about 7 years ago. And those are the ones that are showing on the screen here. And what we've noticed, particularly in the last 3 years, is that every one of these threats is getting worse, and it's getting worse at an accelerating rate. And the reason for that, particularly here in North America, is climatic conditions. The environment is getting warmer and in certain cases a lot moister, and that is creating ideal conditions for the proliferation of a number of these different health threats. We're going to speak to 2 of these specifically in the body of the presentation, COVID-19 and toxic molds, as they are quite relevant for RV parks and resorts. Just before we start, however, from a context perspective, state authorities have mandated that all campgrounds and parks, when they open, have to have a COVID safety plan. And that COVID safety plan encompasses a variety of what you're seeing here, which is a hierarchy of controls. This presentation is going to focus right at the top in terms of eliminating the problem before it becomes an issue for your staff and guests. And in that regard, then, the balance of this in terms of the controls that you implement becomes risk management for your staff and your guests. So let's take a look at those 2 specific health threats that I was mentioning. First is COVID. We're all tired of dealing with this virus, and good news is now starting to emerge. Certainly here in North America, we've seen downtrend of the second wave. Vaccines are rolling out at a more accelerating rate. And I don't know about you, but everybody here is looking forward to a much better summer. There are some aspects, however, to this virus that we do need to be aware of because it impacts the health protection system that you choose and how you go about deploying that. The first is that the virus itself can be aerosolized. And what that means is that particularly in areas where there's not good ventilation, the virus can hang in the air potentially for hours. And that's what's been leading to a number of these so-called super spreading events. In fact, the latest pronouncement by CDC was that it's highly unlikely that people would pick up a virus from a fomite that's left over on the surface. Fomites are just residues of viruses on surfaces. It is much more likely that people pick up the virus from what's moving around in the air. So aerosolization is an important point to keep in mind. The second aspect are the variants. And these have been hitting the press quite frequently now. There's actually been more than 1,000 variants to the virus that have been discovered, yet there's a handful which are problematic. And the handful, particularly talking about things like the British variant, the Brazilian variant, even the Californian one. The UK one, for example, is projected to be about 70% more transmissible and 35% more fatal. And some of them are quite resistant to traditional methods of containment. And this is why you're seeing potential talk about a 3rd wave. Nobody wants a 3rd wave. We're done with this thing, but The risk is there. And in fact, I saw a news release this morning that Italy has gone yet again into another lockdown because of one of these variants, very, very concerned about a third wave. So the takeaway from this leads us to best practice number 2. Best practice number 1 was eliminate the problem before it impacts your staff and your guests. Have that type of a focus. Best practice number 2 is it is not sufficient to just disinfect surfaces. Because of the variants, because of the aspect of aerosolization, it's important that you're able to address interior air quality, including your air handling systems, as well as surfaces. Second aspect, which is an extension to that, is best practice number 3. The health protection system that you deploy has to manage the complete risk profile at your park or resort. There's 2 aspects to that. There are the mandatory things that you have to do that are mandated by the health authorities as part of your COVID safety plan. Being able to disinfect and sanitize rental units at turnover, sanitizing your public facilities, washrooms, laundry, change rooms, that sort of thing. But it's not just about the mandatory requirements. What our customers are seeing is there's been a behavioral change in their consumers and staff. People have become hyper aware of the importance of a safe interior environment. So what our customers are seeing is, at the time people are undertaking their reservation, guests are asking about what the safety plan is, and in a number of cases, not just around COVID. We'll come back to that point in a second. But there's another interesting aspect that happens as your guests start to understand what it is that you're doing at your resort to keep them and your staff safe. It leads to questions, which then leads to potential new services that you can offer. Services for guest RVs and towing vehicles, potentially retail products, and even potentially services that you could offer to your immediate community. People right now are very much preoccupied with COVID, and rightly so. For RV parks and campgrounds, particularly where you have park model RVs, there's a much more serious longer term issue. The pandemic is going to wind itself down this year. Hopefully no third waves. Molds, however, are a much more serious issue and longer term issue for campgrounds. The science has very clearly established that prolonged exposure to toxic molds can cause serious health issues ranging from respiratory to central nervous system, organ damage, and even in some cases, precursors to cancers. Over the last 3 or so years, we've seen that molds are getting much more aggressive as our planet warms. And this is happening not just in facilities, but also in vehicles. That alone is cause for concern. However, right alongside it, we're also seeing an increase in class action lawsuits associated with these. They've always been there for facilities, particularly water damaged buildings. But what we're now seeing is a ramp up of these lawsuits. And there's an example here of Seattle Children's Hospital. They have been battling 2 types of toxic mold in their air handling systems for a very long time, haven't had much success at it. And this has led to what unfortunately is going to be a very expensive lawsuit brought on by patients who had attended that hospital and now are suffering, apparently or allegedly, from mold-related issues. More importantly, though, for our audience here, is that 3 years ago, this moved out of the facility space and into the vehicular space, particularly RVs. There's a class action lawsuit against one RV manufacturer, for example, Keystone RV. And this was a destination RV that a couple lived in, had health-related issues as a result of, again, toxic molds in the air handling system. Got the class action RV certified. This has now made its way across multiple states And unfortunately, it's going to be a very, very expensive settlement. Similarly, about 2 years ago, it moved over to the vehicular spaces as well. So the takeaway from this is that, you know, the cost of ignoring this trend can be very serious for both your customers and your business, evidenced not only by the increasing rate of these lawsuits that we're seeing, but also the cost of settlements that's attaching that. So, you know, what to do about that? Well, this is why we strongly recommend approaching this from a health protection perspective. To be truly effective, a health protection system has to, you know, eliminate any contaminant that is present. It has to do so reliably, and for your business, it has to do so on a sustainable basis, which means being able to generate a return on investment for you. So I'm going to run a short video here on, you know, what are those attributes and what do they imply, and then we'll talk about a couple of them as we move into the back half of the presentation. So that video is a bit of a drink from a fire hose. So let's just recap the important points. So first of all, effectiveness, and this is best practice number 4. Your health protection system has to reliably eliminate any contaminant of any size anywhere. And the reason for that is, you know, we're talking about things in the microscopic world. You don't know what's there. And you can't be spending time wondering, well, should I use this? Should I use that product? You need to confidently know that your health protection system is going to eliminate whatever happens to be in that rental unit or in that public space, whether it's a virus, bacteria, molds, mold spores, allergens, the whole enchilada. And that's what we've referred to as triple threat protection. You want to make sure all of those bases are covered. Secondly, your health protection system needs to eliminate what's there completely. And this is where the argument of log 7 kill versus log 3 kill comes in. The log number basically represents the number of 9s that's there. So for example, a log 3 product, such as a common disinfectant like Lysol, it's 99.9% effective. Now that sounds really good. However, when you're dealing in the microscopic world, you know, you've got millions, if not billions, of these contaminants. And so with a 99.9% effective disinfectant, you're left over with a fair bit after you've done the treatment. And those, based on the way particularly bacteria can replicate, you know, that just means everything is back within days, if not hours. What you're ideally looking for is a log 7 product, something that is 99 with 5 nines after the decimal point effective. CDC will tell you that for anything that's medically related, you need log 6 or better. So look for that, you know, highest kill rate possible in your health protection system. And also, it needs to be able to address not just surfaces, but also interior air quality, including the air handling systems. And it has to do that safely, both for you and for your guests. You also need to be able to do this reliably and generate a sustainable ROI. So let's look at those 2 aspects. So from a reliability perspective, this leads us to best practice number 5. You need a health protection system that's highly reliable and auditable. The staff that is doing this needs to be confident and able to easily achieve consistent results on time and on cost. And really the best way to do that is to be trained to a best-in-class protocol. So, look for your health protection system to come with protocols, both preventative and remedial, that your staff can pick up, that they can replicate repeatedly, so that they're able to do a very high quality job. And also you should have the ability to audit this. There's a tool called a luminometer that can be used for pre and post testing. Those audit results can become very important, both for your staff and if your customers and health authorities choose to ask and audit what you're doing. It provides an excellent background for both your customers and health authorities when they show up. From a sustainability perspective, this comes to best practice number 6. Your health protection system has to be sustainable, and really the only way that it can be sustainable for your business is if it generates a return on investment. We advocate very much that when you're getting into this, you need to understand the business case for deploying this. What results are you going to achieve? What do you have to do to achieve those results? How much is it going to cost? How can I offset the costs or generate additional revenue? Moving from that point, you then want to be able to know that your team will be able to provide the treatments to your facilities reliably, and that comes down to good training and preferably certification to those best-in-class protocols. Last but not least, interestingly enough, as you're doing treatments at your facility or at your park, customers are going to come up to you and ask you what we're doing. We've seen this happen with our customers a number of times. And as you explain what you're doing, the questions will start coming up from your guests to you. Well, could you do that for my unit, or could you do that for my towing vehicle? This is the beginning of what will enable you to generate new revenue at your site with a sophisticated health protection system, and that leads to achieving that sustainable ROI going forward. So again, that sustainable ROI, it comes from your ability to boost reservations, both when your guests are signing up, but also with your asset utilization. And a number of our customers told us last year we couldn't open all our facilities, we didn't open certain rental units. Your health protection system should allow you to open up everything you can open up that isn't mandated to be closed by the health authority, and get that asset utilization back up to where you're at. You should be able to offset a certain number of your COVID sanitization costs, and that comes down to looking at surcharges, for example, for rental unit sanitization or public space sanitization while the pandemic is up and running. It's completely reasonable, and customers are conditioned to that. And last but not least, the opportunity as guests become more aware of what you're doing to generate that incremental revenue, both through services that you can offer as well as potentially things you can sell in your general store. So that brings us to the end of this presentation. Again, what I wanted to do was just bring out and show you 6 best practices that our customers are using for the 2021 season, and the aspects of what those are. They're summarized again here. So at this point, what I'd like to do is just throw it open to anybody who wishes to ask a question. But before I do that, just ask you, Callum, have we received any questions through chat?
Nothing in the chat yet, no.
Okay. So I think it's reasonable at this point. If anybody has a question, just unmute yourself and fire away. There's a couple of questions which normally come up as part of this presentation. First one tends to be around safety. You know, how can we assure that our health protection system is safe for both our guests as well as our staff? Well, the answer to that is, you know, you need to look for one that's registered, and that means with the EPA. And not only just registered, but all of the claims that are being made regarding what the system addresses, how effective it is, those also need to be part of the registration with the EPA, and typically they are. You know, for example, in our business, the fact that we can eliminate any contaminant of any size anywhere at a log 7 cure rate is all backed up by technical documentation that's been filed both with the Environmental Protection Agency as well as Health Canada. Other question that tends to come up is, well, what do I need to be able to have or do to deploy a health protection system? And the answer to that is hopefully very little. The provider that's coming to you ideally should have a turnkey system, and they provide the components that you need. All you need is staff and the time to do the treatment, and to be trained to do it reliably. And then last question tends to come up is, well, how do we migrate from just doing mandatory sanitization to generating revenue? And the answer to that question is severalfold. So first of all, you need to have a mind to want to go in that direction, or a plan to go in that direction. It will start by osmosis as your guests start to ask you questions about what it is that you're doing, and they become more informed and opinionated, and so you will start to see that. But also, you know, the people who supply your health protection systems should be supplying you also with the tools that allow you to reach out to your guests, both at reservation and through e-blasts and other, you know, digital tools that you can do on site to help your guests understand that these are types of services that you offer, that they can be offered while that they're there, that they're quick, that they're safe, and also the opportunity for you to sell products through your general store that are oriented towards consumers. Any other questions at this point? Okay. So I hope you found this informative and of value. You know, our customers are using our health protection system to achieve the types of results that we've discussed. We are a member benefit provider for ARVIC. We're here to help you open safely and provide an exceptional experience for your guests. Hang on, just a question came in. Will you send us information on how to purchase? Yes, we can definitely do that, Billy. There's two aspects. First of all, you can go to our member benefit provider page, and you'll see the spring special that is currently up there. That's one aspect. Second aspect is just shoot us an email to ask@purifydsystems.com, and we'll start the conversation with you surrounding you know, the type of health protection system that you're looking for, what you need to do, and basically work through the business case with you, and then give you a quote on that. Okay, so if there's no other questions, then thank you very much for attending our presentation. Look forward to speaking to you in the not too distant future. Oh, looks like one more question may have come in. No, we're all good. Okay, thanks folks. Have a great day and be safe out there. Cheers.